Hi everyone, my name is Brian Forbes and I'll be sharing with you my presentation on assessment strategies in my healthcare discipline. I work as an advanced care paramedic and have designed this module and its assessments around a topic that would be covered in a typical training day. Just to provide a little bit of background information and help contextualize this presentation, paramedics are mandated by the Ministry of Health to receive a minimum of 24 hours of continuing medical education each year. Typically, this is delivered in a classroom setting and facilitated by one of our governing bodies, the base hospital, which monitors our clinical and field care. I have designed this module and its assessments to be used as part of a continuing medical education session, and therefore the participants would already have a working knowledge of most of the foundational concepts. I'll try not to bore you with all the technical jargon and gritty details of the module itself, and instead I'll focus my presentation on the assessment strategies I've chosen to demonstrate learner knowledge at each phase. I decided to utilize the backwards design model while developing this module because after completing the readings and discussion for that week, I really felt like that was a logical approach to tackling challenges found in an educational setting. So let's get started. I began by employing stage 1 of the backwards design model, identifying desired results. I wanted to design a module around end-tidal carbon dioxide monitoring and its usage in a pre-hospital setting. So to start off with, I attempted to break apart the subject into manageable components and write objectives that conveyed what the learners should know and what topics were really worth knowing. I decided to focus on a basic understanding of gas exchange in the body, knowledge of capnogram morphology, general applications in the pre-hospital setting, and synthesis of concepts in a practical setting. While writing these objectives, I tried to keep in mind the 3 domains of learning as formulated by Bloom. The cognitive domain, focusing on their knowledge of the subject and its uses. Affective domain, attempting to change the current way of thought and foster an attitude that promotes the use of VTCO2 as a diagnostic tool. And psychomotor domain, perfecting their physical skills and proficiency with the equipment. The module outcomes. So by the end of this module, students should be able to identify key anatomical components of the respiratory system, describe the process by which gas exchange occurs, recognize and evaluate different capnographic morphologies as they pertain to patient conditions, apply capnography as a diagnostic confirmation tool in the pre-hospital setting, and utilize capnographic technology to support and formulate a patient care plan. Again, using Bloom's taxonomy while writing these outcomes, I attempted to be specific and concise. I chose to use verbiage that represents each higher level order of thinking in the cognitive domain. Both the objectives and the outcomes would be presented and discussed with the class during the introduction of this module. This would serve as a sort of table of contents for the session, as well as a measure of fairness and reliability, ensuring that both students and facilitators knew what was expected during the module. So to begin the module, I would start off with some discussion and review of the fundamentals of the respiratory system and carbon dioxide. Coinciding with the objectives and outcomes, we would cover basic structures and functions of the respiratory system, values of gases at various stages in the respiratory system, and etiologies that may prevent or facilitate their exchange, and discuss the function of carbon dioxide in the respiratory system, what mechanisms regulate its concentrations, and exactly why this is all important. This will provide foundational knowledge for the rest of the module. Again, most of the content being covered is review for working professionals, but this will again add to the validity, fairness, and reliability of any further formative assessments that we use, by ensuring that all students and instructors have the same or similar knowledge before proceeding on to the next topic. To keep learners engaged and determine if they have retained the material that was recently covered, I have attempted to employ some degree of formative assessment after each topic. This will allow the facilitator to gauge the progress of the class and identify any areas that may require further attention before moving on. For these mini assessments, I would utilize an electronic answer pad. Some people will have referred to them as clickers. Essentially, they allow students to respond to questions the facilitator asks in real time and anonymously. This will help reduce the anxiety that is felt by students having to answer questions incorrectly in front of their peers. In addition, the facilitator will be able to make adjustments to the module fluidly if any issues present themselves. These measures were developed to follow the second stage of the backwards design model and help determine how to evaluate if students have learned what the objectives and outcomes have stated. So after the first section of the module is completed, I would pause to assess the learner's knowledge before proceeding on to the next stage. As most of the foundational knowledge is of the lower spectrum of Bloom's taxonomy, I would mainly be assessing for knowledge and understanding. Using diagrams and one or two multiple choice questions, students could demonstrate their knowledge and level of comfort with the content. Again, using the clicker, students would be assessed under anonymity while providing the facilitator an accurate snapshot of their progress so far. Moving on to the next topic, students will build on their knowledge and begin to contextualize the theories. Drawing on the third stage of the backwards design model, I plan this learning exercise to be performed using simulation monitoring that paramedics would encounter in the field. I would attempt to demonstrate various morphologies pertaining to breathing patterns such as hypo or hyperventilation and shallow and deep respirations. Following that topic, I would again use formative assessment techniques to determine the progress of the class. Attempting to maintain validity, reliability, and fairness, students would be presented with similar formats to that which they had previously experienced in the lesson, and asked to apply their knowledge by answering a small set of questions. Again, this would utilize the clicker and provide instant feedback to the facilitator in a low-pressure environment for the students. The next phase of the module will begin to challenge the learner's ability to evaluate and apply their knowledge by presenting them with information relevant to their actual practice. At this stage, they'll be afforded the opportunity to practice with the equipment and learn how to assemble, access, and troubleshoot on the cardiac monitor and any other equipment necessary. So the ongoing formative assessment for this portion will measure the student's ability to properly demonstrate the assembly and procedure, as well as list any indications for its use. We then move on to the review phase. This phase of the module will be able to review key topics and important points we've covered thus far, leaving the students with a little bit of takeaway for the real important things that would be covered in the module. To gauge the student's progress after the review phase and really almost a cumulative review of the module thus far, facilitators will use questions and discussions. Questions will ideally be student-driven, but sometimes, as we all know, learners don't really like to ask questions in a classroom setting, and in that case, the instructor may present some of the questions to the class. This provides not only an opportunity for clarification of anything that may have arisen, but it's also a gateway to discussion. And discussion as an assessment tool will help the students develop critical and creative thinking and reinforces and builds upon their knowledge. The instructor is also able to gauge the comprehension of the subject and make any adjustments to the learning activities to suit those findings. At this point, we'd move on to a scenario. So students will be able to participate in a learning scenario, which is designed to incorporate both their theoretical and their practical knowledge on the subject. The scenario I've presented here involves a call to a local bar for a male patient who's found vital signs absent, and will require participants to use equipment and resources they would have found in the field. The students that are not actively participating in the scenario will be asked to watch the participants closely and make notes on the decisions and actions of their peers. As this is a learning scenario and not really intended to be a high-pressure evaluation, the students participating in the scenario are able to ask for assistance or guidance from the other observing classmates. This will help to reduce the anxiety experienced while performing in front of their peers. The assessment strategies used after this phase will involve observation, evaluation, and discussion, which will all demonstrate to the instructor and to the students their level of understanding and appreciation for the subject matter. Now, the last stage of this module will be a summative evaluation. This will be in the form of a written test comprised of approximately 35 questions. Each question will be based upon the material covered and presented in a similar format to what the students have already encountered. This will ensure that the evaluation is valid, reliable, and fair. In addition, the questions would draw on the foundations of Bloom's taxonomy to ensure that all levels of thinking in the cognitive domain are represented. As most of the situations paramedics are presented with in the field require a high degree of critical thinking, adaptation, and decision-making, I would place emphasis on questions that represent the higher order of thinking in Bloom's taxonomy. So here's just a few examples of sample questions that would be included in the summative evaluation. And again, the summative evaluation would demonstrate the overall effectiveness of this module and the knowledge that students have obtained throughout it. Additionally, it will provide the instructor valuable information that can be used to make any adjustments to the module in the future. So thanks everyone. Thanks for taking the time to watch the presentation. I hope it offered you a glimpse into the benefits of ongoing formative assessment at various stages in a learning module, and I look forward to hearing your feedback.